Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. We're going to talk about a very common condition, which is numbness in the hand. Generally, when a person goes and has numbness of the hand, the first thing the doctor thinks of is carpal tunnel syndrome. So the carpal tunnel is basically a tunnel through which the median nerve goes through. So it's in the wrist. There's various bones that form the tunnel. And basically, I'm going to review an article which is entitled Dynamic MR Imaging of Carpal Tunnel Syndrome. It's in Skeletal Radiology. It was something from 1997. You might say, geez, Doc, why are you doing something from 1997? I'm just showing you that, like, even in 1997, there was MRI evidence that basically the carpal tunnel diameter and the structure over the carpal tunnel, the transverse carpal ligament, changed with motion that's documented by MRI to cause carpal tunnel syndrome. So in other words, you can have carpal tunnel syndrome from what? Ligamentous laxity. Like, in other words, the carpal bones are moving too much, and then this narrows the canal, and then you get carpal tunnel syndrome. Then I like this one because it distinguishes from true carpal tunnel syndrome and pseudo carpal tunnel syndrome. When you have true carpal tunnel syndrome, what's first affected is the outside of the median nerve. When that's affected, you get numbness, typically in the thumb, the index, and middle finger, not in the little finger. Then eventually, as the disease progresses and the nerve gets more and more damaged, the nerve innervation to the muscle, basically the thumb here, as those muscles don't have innervation, the muscles atrophy. So that's where you lose the muscle here, and that's a sign of advanced carpal tunnel syndrome. Even if a person gets surgery and it relieves the nerve impingement, by the time that the nerve has been so damaged that the muscles atrophy, sometimes you don't get the atrophy back. So that's why early on, if you have numbness in the hand, you have to get it evaluated. The way that we evaluate it is by dynamic ultrasound, and then I'm going to show you a normal median nerve that has flexibility within the carpal tunnel. Pseudocarpal tunnel syndrome, I termed that years and years ago because I had people who had numbiness. It means that when I did sensory examination of their hand, they could feel everything 100% compared to the non-involved side. So they had the sensation of numbness, but when you tested them, the sensation was normal, so I called that numbiness. Numbiness is normally from ligamentous injury on the lateral side of the elbow, specifically the annular or radial collateral ligament. So this just distinguishes the two. So basically, also what can cause hand numbness is cervical radiculopathy, or pinching of the cervical nerve. So this graphic distinguishes between numbiness from ligamentous injury, carpal tunnel syndrome, and cervical radiculopathy. So numbiness is with ligament injury. True numbness can occur from carpal tunnel syndrome, or I have a little bit of C6 radiculopathy, so my C6 nerve. So I'll get tingling, but in me, my sensation is fine, so I don't have numbness here, but a pinched nerve at C6 that can cause you to have numbness here. Then symptoms worse with wrist extension or wrist flexion. That puts tension on the carpal tunnel. So this motion, if you hold it and the numbness gets worse, that is indicative of carpal tunnel syndrome. Symptoms are worse with head rotation. Well, obviously, the C6 nerve root on the right side will get compressed with extension and rotation. So somebody could hold this position, and if that causes numbness, then you know that that's from cervical radiculopathy. And somebody who has elbow pain and numbness, that would be a sign that it's an elbow problem. Or if you push on the elbow here and you get radiating pain into this area, that's a sign that you have ligamentous injury. So carpal tunnel syndrome is basically you get compression of the median nerve in the carpal canal there, the carpal tunnel. Then if you have annular ligament injury or radial collateral ligament injury, that can give you numbiness in the distribution of the same as carpal tunnel. And another thing that can simulate it is if you have a thumb problem. So there's people that have different kinds of sensations, like in this region, and they, on ultrasound, when we do stress ultrasound, the joint here will open. And when I do a grind test, they have clicking, popping, grinding here, and basically they have joint instability here. So if there's joint instability here in the thumb or joint instability here in the wrist, the treatment is prolotherapy. So this just shows prolotherapy. And on x-ray, you will see that their cartilage sometimes is gone at the base of the thumb. When somebody does have carpal tunnel syndrome, often what we'll do in the office is called hydrodissection. So I'm going to actually show hydrodissection of the median nerve. It's really, really fascinating. So it used to be when I was first in practice, man, everybody was getting surgery for carpal tunnel syndrome. And these were really big surgeries. You'd see people with these big scars to release the median nerve by cutting that transverse ligament. Well, it's interesting. Now you don't even hear about that surgery anymore because you can actually, with ultrasound guidance, go right around the nerve. So go right around the nerve, inject a bunch of fluid, and you'll see the nerve will then, it might be released like that far. You'll see it because the fluid, where it's stuck on the transverse ligament, then it'll go down, so you totally release it. And as long as you correct the joint instability or whatever caused that, as long as you correct that, also people can get cured of or resolved of the carpal tunnel symptoms. Hydrodissection or fluid around the nerve, sometimes that has to be repeated like prolotherapy for 3, 4, 5 times, but it's very, very effective. And obviously, compared to surgery, it's way, way less invasive.